Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Health Ministry says hospitals located in and around COVID-19 containment zones should treat suspected corona patients. Dearness Allowance hike for central government employees and pensioners put on hold till July next year. Secretary Health and Family Welfare Nagaland informs that the Dimapur-based patient is under observation, and a total of 1,409 fresh COVID-19 cases reported in the country in the last 24 hours. Ministry of Health and Family Welfare has suggested that hospitals in and around COVID-19 containment zones must treat all patients as suspect COVID-19 cases until proven otherwise and exercise standard care. Ministry has issued the guidelines after detection of suspected COVID-19 case in a non-COVID health facility. The ministry said that a COVID-19 case with mild and asymptomatic may go undetected and inadvertently transmit the infection to other patients and healthcare workers, putting these individuals at risk and compromise the functionality of healthcare facility. The guidelines stated that whenever a known COVID patient or any healthcare worker is suspected to have COVID-like symptoms or test positive for coronavirus, the Hospital Infection Control Committee will come into action, investigate the matter and suggest further course of action. Government has put on hold increase in Dearness Allowance for its employees because of the strain on its finances due to COVID-19. In view of the crisis arising out of COVID-19, it has been decided that additional installment of Dearness Allowance to employees and Dearness relief to pensioners due from 1st of January this year shall not be paid. Additional installments of Dearness Allowance and Dearness relief due from 1st July this year and 1st January 2021 shall also not be paid. However, Dearness Allowance and Dearness relief at the current rates will continue to be paid. As and when the decision to release future installments due from 1st July 2021 is taken by the government, the rates of DA and DR as effective from 1st January 2020, 1st July 2020 and 1st January 2021 will be restored prospectively. Secretary Health and Family Welfare Gesuna Yome, in a press statement, informed that the department is in touch with the Guwahati Medical College Hospital officials in regard to the patient from Nagaland who was tested positive at Guwahati. He said though the second test was negative, however the subsequent third was positive. Nevertheless, Yome informed that the patient was stable and has been shifted from the ICU to the isolation ward for further observation. A fourth test is due in a few days. Yome added that the department is also collaborating with the national print media on a project called Project Step 1 to reach out to the citizens who require medical consultation over phone. Citizens requiring such assistance can call the following state toll-free helpline number 1800-345-0001. I repeat, 1800-345-0001, and they will be guided to the appropriate consultant from a pool of doctors from across India, depending upon the caller's query. You may informed that for the whole state, as of 3 p.m. today, a total of 543 samples out of 607 sent from Nagaland have been received, and all have been tested negative. Prime Minister Narendra Modi will interact with all the state chief ministers on 27th of this month. He will interact with them through video conferencing. This will be the Prime Minister's third video conference with all the chief ministers since the lockdown was imposed in the country to check the spread of the coronavirus. The last such video conference between the Prime Minister and the Chief Ministers was held on 11th of this month, days before the lockdown was extended. Prime Minister will also address various Gram Panchayats across the country tomorrow on the occasion of National Panchayati Raj Day. He will interact with various participants through video conferencing in view of the lockdown. Prime Minister Modi will also launch the unified e-Gram Swaraj portal and mobile app on the occasion. This news comes to you from All India Radio, Kohima. A total of 1,409 fresh COVID cases have been reported in the country in the last 24 hours, taking the total number to 21,300 393. As many as 4,258 patients have recovered and have been discharged from the hospitals, while 681 patients have died. Health Ministry spokesperson said there are 78 districts in the country where no new cases of COVID-19 have been reported in the last 14 days. He also said there are 12 districts which have not reported fresh case in the last 28 days. Meanwhile, recovery rate of COVID-19 patients in the country has improved to 19.89%. The Chief Minister Relief Fund for COVID-19 Nagaland has received a total amount of 3.53 crore rupees from 27th of March till yesterday. Nagaland Chief Minister Nipirio, in a tweet today, mentioned that as on 26th March, the Relief Fund had an opening balance of 84.70 lakh rupees, where 107 donors have donated above 10,000 rupees, while 241 donors donated below 10,000 rupees. Rio said 45.5 lakh rupees were dispersed for students, working people and other Nagas stranded outside. The Chief Minister also said 198 lakh rupees have been given to Deputy Commissioners of all the districts and Nagaland State Disaster Management Authority. Meanwhile, the state government has extended relief to local daily wage earners and migrant workers. Total number of labourers and migrants helped till date is 1,24,040, while total relief extended by NSTMA is 8 crore rupees. Principal Director of School Education Shanavas C said schools in Nagaland will have to reduce the limit of the summer and winter vacation because of the national lockdown due to COVID-19 pandemic. Speaking to a section of media persons today, he said the department has to cut down the holidays for students as we have lost more than 1 month due to the extension of lockdown. Shanavas said, in order to make up the loss of classes for 2 months, it will make Saturdays and working Saturdays and also reframe the academic calendar. He also informed that NPSC results will not be delayed due to the lockdown as paperwork are done in decentralized manner. He said declaration of NPSC results is expected by the month of May. However, the dates could not be ascertained. The Principal Director said, after thorough consultation with the board, the date will be updated and expressed hope that the results will not be affected. Beneficiaries of AAY and PHH ration card holders in Kohima are receiving free food grains under Pradhan Mantri Garib Kalyan Anna Yojana starting from today. The distribution is done by the Department of Food and Civil Supplies in Kohima district. Speaking at the distribution program, Deputy Commissioner Gregory Tajavela said that through this scheme, AAY and PHH ration card holders will be receiving 5 kilograms of rice per person free of cost in view of the lockdown period. He said besides the National Food Safety Act received by the beneficiaries at a subsidized rate, these additional food grains are being distributed free for 3 months, with a target to reach out to the people who are in need and the poorer sections of the society. Meanwhile, the distribution of rice will take place at Ministers Hill Colony and Bayavar Colony tomorrow. Nagaland government, in an order, has permitted some activities in the state with immediate effect following the orders from the Ministry of Home Affairs. The activities include food processing industries in rural areas which are outside the limits of municipal corporations and municipalities. Industries operating in rural areas, including stone crushers, sawmill, brick kilns in rural areas which are outside the limits of municipal corporations and municipalities, collection, harvesting and processing of minor forest produce, non-timber forest produce by scheduled tribes and other forest dwellers in the forest areas, bamboo, coconut, arganut, cocoa, spices plantation and their harvesting, processing, packaging, sale and marketing, construction activities in rural areas including water supply and sanitation, laying or setting up of power transmission lines, and laying of telecom optic fiber and cable along with related activities. Functioning of research establishments dealing with agriculture and horticulture activities, inter- and intra-state movement of planting materials and honeybee colonies, honey and other beehive activities, shops of educational books for students and shop of electric fans, recharge facilities for prepaid mobile connections, functioning of food processing units such as bread factories, milk processing plants, flour and dal mills, and other mills located in urban areas. The order further stated that social distancing must be ensured for offices, workshops, and other factories, establishments as specified in the lockdown measures, national COVID-19 directives, and standard operating procedure. And now to end the news, here are the main points again. Health Ministry says hospitals located in and around COVID-19 containment zones should treat suspected corona patients. Dearness Allowance hike for central government employees and pensioners put on hold till July next year. Secretary Health and Family Welfare Nagaland informs that a Dimapur-based patient is under observation. And total of 1,409 fresh COVID-19 cases reported in the country in the last 24 hours. That is all we have in this evening news bulletin. Good night.